we were getting into a more and more importance in the lives of our patients. And then in the same year, that's why it was so interesting happening, I met this other gentleman. And I said the same thing, structure consultation, pick 3 areas and pick 3 emotional attributes, done. And of course, we have to assess the patients at rest and also on animation. But my surprise was when he smiled. Take a look. I would like to ask my fellow friends here, imagine this gentleman is a doctor and he's a pediatrician. Would you like to have him take care of your kids? Do you understand? So my question was, there was a message that we conveyed that I asked myself, can I trust him? Really, can I trust him? The answer is no. And then, that's why I started introducing the MD-DINA codes, which are the codes for facial expression. And take a look now. Then I start wondering, can I do this with surgery? Okay. Right? Do you understand how something started entering my mind? Now he looks trustworthy. So these changes, it was bringing more and more excitement to my professional career, saying I need to study harder. So the myomodulation principle was launched back to 2017, and the social attributes was launched in 19. Different perspective. Not only should I ask my patients what would you like to look less tired, but would you like to look more trustworthy or more confident? Because this impacts our professional career. But do you know where the myomodulation principle started? Taiwan. Here. It was here that, of course, Maggie started showing me something. See, Mauricio, take a look. When you inject this, take a look what happens on the face. I said, you know. And this was, after some years reviewing the before and afters, in 2013, I understood it. And I would like to bring this case to you. Take a look. Patients, when they present certain structural deficiency, this affects the way we kiss. Okay? Look attentively. There was something lacking in the chin projection that could not coordinate the kissing movement. So, knowing that I needed to promote coordination, I came to the sentence that guides me every time: structure defines function. When we age, we lose structure. Our fat pads move, we have bone resorption, our muscles act completely differently. So that's why, interesting, we are 20 years old, we look gracious, we reach 50, we look bad. Right? So aging disrupts the position of fat pads, subcutaneous, and muscle reactions. Now, I started putting this into practice, and over, something like this. Look, we know this is not something very easily treatable, but if structure defines function, Asian patients may have a recessed maxilla with empty fat pads. What happens with the levator of the muscles? It's stronger. So then we have hypermaxilla with acting muscles. Then I thought, okay, so if this distortion happens because the patient is empty, where the muscles contract, put fillers. And then that's what I did. Take a look. We ended up by controlling excessive muscle contraction. I was very happy with this Gummy Smile treatment, but I would like you, my friends, to see this other case that I did in Bangkok last year. Okay? Take a look at this. Typical Gummy Smile. Okay? It's a Gummy Smile, and this patient inverts the upper lip, as you may see here. Right? And the chin is recessed. So when she smiles, there is a lack of coordination, the chin goes backwards, it affects the lip. Agree with me? Then I treated her. Take a look if you can perceive the changes, what happened with her lips. I treated, of course, her cheek, chin, and lips. Take a look at this. Can you put the lights down? 不好，很好，不漂亮，很漂亮。The lips, they send a very important message socially. And I know many people, when they have Gummy Smile, they even hide or they avoid smiling with pleasure. So now, her life has changed. Do you understand? That's what I tell everybody. Do you understand what we are here studying every day? And what's the role we can play to our patients? It's very interesting if you really think. So, and then something was interesting. So I was starting to analyze, okay, I came here